Hey everyone, I'm Dr. Josh Jagoda, and today I'm going to discuss cortisone injections. And this is something I see a lot in my athletes. I see this a lot in random patients who come into me, and maybe potential patients who want to come into me. And a lot of people are like, well, I had a cortisone injection, or I want one. And I'm going to talk just a little bit about what it is and what you should look out for and things like that, and some general basics with cortisone injections. So pretty much a cortisone injection is just an injection of usually a local anesthetic and a corticosteroid within that joint space. So it could happen into the bursa. A lot of people will see this as a result of an injection to an elbow, a shoulder joint, a bursa, a knee, or a hip. And a lot of people will get this injection. Almost everybody out there has heard of a cortisone injection, and the truth is that these methods are a lot more outdated nowadays. This medication or this injection is about 30 plus years old, so it's really not as up to date as it once was, but yet a lot of medical doctors will do it and will use it. So I'm not going to speak if it's right or wrong for them, but I'm just going to say that a lot of people do it. So first things first, I have a little drawing here of, I guess you could say, a knee here without the patella, and a lot of people will have knee pain. And really what the doctor will do is they'll take a needle, with some, of their type of their injection, and they'll inject it right into a site right here. And so really the injection will serve to help reduce inflammation because corticosteroid, or cortisone I should say, is really just an immune suppressant. And so we really try to label that as an anti-inflammatory, because if it suppresses the immune system, meaning it stops the inflammation, it will decrease the swelling and it will decrease the actual pain. And so a lot of patients will feel a lot of relief with that. There of course are some drawbacks, of course, but it can have some serious immediate effects in terms of positive effects for decreasing your pain. Now, a lot of people will also notice that after about 3 injections into the same site, so if this is injection 1, 2, and now you have your 3rd injection, many doctors will say that you should not get more than 3 injections per site. And I agree. And the reason that happens is that because it does have some cartilage and bone destructive properties once you start reaching a certain elevation of that. And really also another thing is it doesn't actually solve your problem, right? Think about that, guys. If you are getting injection over and over again and your doctor's recommending this and he's not learning how to fix the problem or directing you into a way to fix this problem, then that's an issue, right? So this medication, or this cortisone, does have some bone destructive properties. Particularly, it will demineralize that joint, and so a lot of people, including medical doctors, will avoid it because it will start to erode away some of the bone here and there at that injection site, and so you will actually have decreased healing ability. So they have done studies, and one of the studies show that this medication actually does reduce pain immediately. So why do you think a lot of people use it, and why do you think a lot of doctors do it? Because patients feel better after. The problem is that anywhere between 6 months and 1 year out, so if you fast forward 6 months, what people have noticed is that there is actually an increase in recurring rates. So I'm going to just label that RR, recurrence rates of their injury, and there is also a 67% decrease in healing. So think about that. So the recurrence rate of 67%, and as a result there is also a decreased healing properties. So what that really tells us is that after you get these injections, you'll notice pain goes away, pain feels better, but long term it's not actually solving the issue. And one of the reasons why people have such a high recurrence rate over here is really because if the people are out of pain, they're going to realize that they don't need to do their stretches, they don't need to do their rehab, and it's not actually solving their problem. So at the end of the day, guys, you're gonna have to do your exercise, eat healthy, do your nutrition, do this, do that. You're gonna have to work at increasing your strength of your supporting ligaments and tissues to help prevent this pain from coming on, so that you don't have this increase in reoccurrence, and so that you don't have decreased healing capacity in the future, because this type of stuff is not going to solve it. It's just going to help you temporarily. So, and one last thing I do want to point out with regard to cortisone is that it acts like cortisol, right? It is very similar to that in that it will possibly spike your blood sugar levels. So now I say possibly because it's supposed to be a local joint injection, but sometimes this joint injection can leak out a little bit and start to go into the bloodstream, and so now it can go into the bloodstream, and so if you're eating foods, you have to watch out for that. Most of the time, cortisone, or I should say actually steroids, whether taking orally or within the actual intravenously, you will have to watch out for your blood sugar levels. But with cortisone injections, it's supposed to be localized, but like I said, sometimes it seeps out and goes into the bloodstream, and that can have systemic effects on your blood sugar levels. So if you are somebody who has already gotten this injection, or you're really going to just get the injection or consider that injection, keep this in mind, especially if you're diabetic. You're really going to want to watch and monitor your levels a lot more seriously, and you're really going to want to make sure you hone in on your diet a little bit better. So that gives you a little bit of insight on cortisone injections. You know where I stand on this. I really don't think they're a long-term solution, and really they're just masking up the problem, and they're not going to give you a long-term solution, like I said. So guys, nothing beats hard work. Nothing beats actually doing your stretches, doing your exercise, and eating properly, and sleeping well. Really, if you want to look for the shortcut, I guess you could say this is the way, but this is the immediate way within the short term. But in the long term, you're going to be just back at that 67% with decreased healing, and then you're going to want to feed back into this cycle, and then this cycle will just repeat over and over, where you have pain, inflammation, discomfort, get the injection site, don't recover as well, and then guess what you do? You keep coming back to this until the doctor says, hey, you've been at 3-4 times this year, no more. And then you actually increase your risk for injury again. And then that can also lead to other issues, but we won't talk about that right now. So you can see how this cycle can be dangerous, guys. Give it a second thought. Give it multiple thoughts. Discuss this with your medical doctor. Discuss this with your surgeon, with your orthopod, with your physical therapist. Get some insight, because I see this all too often, and this type of technique and this type of cycle is dangerous because it doesn't solve your problem, and it really won't give you a solution. All right, guys? I'm Dr. Josh Jagoda. Thanks for stopping by, and I'll see you guys next time. Bye.